Congressman Ramirez, you're recognized. You came in after.
Thank you, Chairman. Well, it's been a year. It's been a very long year. And I've been really thinking about the work that we do here. And I want to talk a little bit about a recap. Since the Secretary stepped into leadership, the VA has eliminated diversity, equity, and inclusion initiatives. It's allowed DOJ access to VA's data. It's made it its mission to help reduce the VA workforce by 30,000 employees by the end of 2025. And it's also doubled down, removing 35,000 healthcare positions this month, according to an internal memo, according to VA staffers and congressional aides. So I gotta say, folks, it's hard to believe that Secretary Collins gives a damn about veterans when he's actively undermining the mission of the VA. You can't say you serve veterans when their doctor appointments are being delayed and canceled due to staffing shortages. You can't say you serve veterans when you repeatedly attack the VA workforce who actually serves our veterans. And today we're gonna talk about the Community Care Network next generation contracts. While Collins tears down the VA with one hand, he then doles out the pieces to corporate interests with the other, enriching them while veterans are gonna go unserved and uncared for. In his actions, we see exactly who Secretary Collins really serves. Driving the VA towards privatization, we know only serves corporate interests, and it puts profits over veterans. So I wanna get into some of these questions. Despite the VA's severe staffing shortage, the next-gen contract structure introduces significant oversight complexity. The VA is planning to establish a bench of contractors through this 10-year indefinite delivery, indefinite quantity, multi-award contract model. Contractors on the base, IDIQ, will compete on task orders so that the VA will have many layers of contractor activity to oversee. So, Mr. Toppin, given that the VA is down 30,000 employees with the plan to get rid of 35,000 more positions, it's really hard for me not to wonder who exactly you plan on having oversee this contractor activity. Because according to a GAO report released in August 2024, the VHS Office of Integrated External Networks, which is involved in oversight of the contracts, was staffed at 57% of its authorized level as of February of 2024. At the same time, the contracts management and performance team within that office was staffed at about 50% of the authorized level. Committee staff asked for updated staffing numbers during our recent briefing with you on the CNN next-gen procurement, but the VA has yet to provide those to committee. So, Mr. Toppin, here's my question. How do you anticipate meeting its contract oversight and execution obligations, particularly given the President's ongoing limitations on hiring?
Representative, thanks for the question and the chance to set the record straight on this. So let's talk about staffing. VA is appropriated for 455,000 employees. Our operational strength is 447,000 employees. That's a delta of 8,067, actually. That's the delta. 5,000 of those are clinicians in the clinical setting in VHA. We are working to fill those to ensure that we are fully staffed. There's an 8,000 employee difference, not 35,000. This garbage story from the Washington Post about 35,000 positions being cut, it's not true. The Post reached out to us, to my staff.
So, Mr. Toppin, I want to really specifically come back to the CCN contract oversight, and I want to just do a follow-up question because I know we have limited time here. How many positions, so let's go specifically here, are currently authorized for CCN contract oversight and execution? And number two, do you intend to increase the number of authorized positions for the next gen?
We will build the program management capabilities necessary to manage a contract.
Do you have a number of how many you're going to authorize?
I do not have a number yet because we haven't built it yet. We are in the process of doing that. What we are bringing to you today for your oversight is the design of CCN Next Gen. Program management is the next. And again, I say what I said earlier. This is not unique to VA. We have the Center for Medicare. CMS does this. We are not the only ones to manage a program like this. We will look at best practice, best structure. We will bring those to VA, and
So
it's not just the federal level.
As you're looking at this best practice, let me ask you a follow-up question. As you're doing the planning, tell me a little bit about how you're considering what percentage of the currently authorized contract oversight positions you already have available to be filled.
The way we manage the current contract, which is an unmanaged contract and very different from what Next Gen is not the same as we're going to program management and design the new one. We will design program management inside VA to match the needs
Mr. Toppin,
of
my
a
time is
program.
up, but I definitely want to make sure that we have a follow-up on these staffing numbers, that it seems like you have a number and we have another based on the memos that we have seen, so we'll follow up. Thank you.